Dear doctors, homeopathic lovers, and students, today is the 2018th day of uninterrupted webinar series of IFPH. Today's our guest is Dr. Neha Kakkar from New Delhi. Currently, she is a practicing homeopath. She is practicing in Uttar Pradesh. She owns a clinic, Homeo Cure and Care Clinics at Miradesh. She is one of the chief moderators of a case present. She has presented a topic on cancer, its care and homeopathic management in the All India Homeopathy Congress held at New Delhi in 2023. She is a member of Surat Homeopathic Medical Association, Surat Red Cross Society, and South Delhi Homeopathic Association. And today she is dealing with the topic chronic rhinitis with polypoid growth in nose, a homeopathic overview with a case presentation. And chronic rhinitis is one of the areas where homeopathy has a great scope. And I am inviting all to listen to the section. And I am inviting Dr. Neha Kakkar to handle the section on chronic rhinitis. Madam, a warm welcome to you to handle the section.
Dr. Hema and Dr. Dinesh in the English session again. And thank you IFPH and everybody for giving me again the opportunity to present a session today here. So it's been quite a time moderating the sessions and also presenting. So I had previously presented this topic in Hindi. Now today I'm presenting this topic in English today. So without going for any more time, let's start with the presentation. Is my screen visible?
Yes.
Yeah. Okay. So this is quite a common ailment which we are discussing today. It's a very common disease which we encounter in our clinics every day. That is the polypoid growths in the nose along with the chronic rhinitis. Now, these polypoid growths, as I said, we encounter in day-to-day practice very frequently. And most of the patients which we come to a homeopath comes with the complaint of that they have this growth since a longer period of time and they have been advised the surgery for removing these polypoid growths, and they have other associated complaints also, or otherwise they have some other complaints. They might not be aware that they are having some growth inside, but on doing the investigation, certain investigation, these growths are found in the nose and they are advised surgery for it. So most of the patients come to a homeopath to avoid the surgery. So it's a major area where homeopathy can play a good role and where the growths can be decreased using homeopathic medicines, constitutional also, and some specific medicines also. So in the end, I'll be sharing two cases where in one of the case we will see the constitutional treatment working, and in the other case we will see more of the specific drugs which we use in these kinds of ailments. So what exactly are nasal polyps? Nasal polyps are overgrowths which are soft, non-tender, cancerous, non-cancerous, or benign growths, uh, and which are tear-shaped often, and they are found on the lining of the nasal passages or sinuses, often caused by the chronic inflammation of the nasal cavity. The inside of the nasal cavity, it gets inflamed, and due to which we have certain conditions which lead to formation of these non-cancerous or benign overgrowths inside the nose. So here in the picture, you can say these are mostly like teardrops, and whenever you examine the patient, in these cases, examining the patient is a must, because until and unless you see the growth from a torch or from any other, if you have a nasal endoscope, that would be a better thing to have. And most of the homeopaths, avoid, examinations. But I often recommend that you should examine the case, mostly in these growths of, if you have your nasal growths, or even in cases where ear involved, where we have ear inflammation, ear discharge. So we need to examine the patient. That's a very important thing. So, what are the key aspects of these nasal polymoid masses? What are the nature of their growth? They are typically benign, soft, non-tender, and movable, resembling teardrops or peeled grapes. And their cause, what is the cause behind this thing? Often, the people say that we have this growth inside the nose, and we also have certain other conditions, like they have some kind of sinusitis or chronic rhinitis running along, or certain kind of allergies. They might be having sneezing attacks, which may get aggravated in different times of the day. They might be having asthma or bronchitis also, along with certain lung conditions, and also sometimes fibrosis of the internal nasal cavity or also of the lungs. So these adjuvant conditions are always present there with the nasal polypoidal masses. And most of the time the patient is under the impression that these polypoid masses are causing these conditions, but the case is always the other way around. There is chronic inflammation. There is certain condition which starts as only a simple cough or a cold condition. There is some cold coming up every whenever there is a season change or in the winters, and that ultimately leads to chronic irritation of the mucosal lining of the nose, and then it leads to the starting of that growth starts growing up. The starting happens from that place only. That chronic inflammation, it kinds of accumulates the a line of tissue, and that tissues keep on getting accumulated, and then it forms that polypoidal mass. So this chronic inflammation or chronic condition is always present with these polypoidal growths, be it sinusitis, allergies, or any kind of lung conditions. Then there is another condition which very much mimics the nasal polyp condition, that is nasal turbinate hypertrophy. Now, what exactly are nasal turbinates? Now, as you can see in the picture, the nasal turbinates are normal bony structures. They are not exactly bony structure, they are bony cartilages actually. So these cartilages are present on both sides of the nasal cavity, and their main function is to stop the bacteria, viruses, or any foreign bodies from entering into the upper side of the nasal cavity and going into the as the nasal cavity is also connected to the brain. So they try to trap whatever foreign substance, or whether bacteria or viruses, or any kind of allergen. They try to trap those allergens or any foreign body, and their basic function is that. But what happens whenever there is any kind of inflammation, they also start growing in size. So they are almost like the polyp, but are less fleshy and less soft in nature, because as I said, it is made up of cartilage, and cartilage is quite thick and hard. It's not exact bone, but it is softer. So these also grow up whenever there is a encounter with any allergen or any inflammation. Both conditions can give rise to similar signs and symptoms, and sometimes it is difficult to distinguish the two, because polyps are, but the basic differential factor which we see is that polyps are softer in their look, and they tend to look more of a fleshy mass, whereas the turbinates have a more cartilage like look. And when you examine the patient, then only you will be able to make out the difference. It's not easy to explain it theoretically, but when you practically look at the cases, then only we can distinguish the two. Final diagnosis can be confirmed through the nasal endoscopy. As I said, if you have a nasal endoscope, that's a very good thing. You can examine in the nose of the patient from the nasal endoscope. Otherwise, you should always look with your own torch, whatever kind of torch or mobile torch also you can look up and see and examine the nose, definitely, because that tells us the extent of the blockage is there. Most of the time, the polyps are smaller in size, and this turbinate hypertrophy is larger in size and covers, almost, blocks the whole nasal area. And most of the patient, and as you are going to see further, we are going to see the symptoms which we encounter, which can lead to the different signs and symptoms. So the basic sign or symptom which we come across is the nasal obstruction, chronic congestion, difficulty breathing through the nose. Most of the patients with this condition sleep with mouth open at night as they cannot breathe through the nose properly. I have many cases of these condition, and majorly in children. Recently also I had a child from outside UP. She was from Agra, and that child used to breathe. She used to sit and breathe. She could not even lie down, and she did not have that proper circulation in the nose, because the whole nose was blocked due to this polyp that was present inside. And she used to, most of the patients, they breathe through the mouth. They can lie down and they open their mouth and they get that oxygen or the breathing from the mouth. But in very severe cases, like in that child case, she used to sit, because without sitting there was no circulation of air inside the nose, so she used to breathe while sitting, and that too through the mouth. Then the second symptom which we encounter is reduced sense of smell or taste, which is often a primary symptom, because the whole of the mucosal cavity is damaged here, it is inflamed, and it is covered by that polyp or the nasal terminate. So we often see that the sensors or the receptors which are responsible for the sensation of smell, they also start diminishing, and we see a loss of smell there. Then they have discharge and pressure, most nasal drip, runny nose, or facial pressure. Whenever there is associated sinusitis, the sinuses are also involved in the frontal sinus or the maxillary sinus. We see discharges which are thick or greenish, or whenever there is associated allergy, we see a more of a runny kind of discharge, runny nose, and allergies and sneezing. And often facial pain and pressure is present in cases where there is sinusitis. Then another very important symptoms that occurs is that of snoring. Sometimes in a clinic we see patients coming up with the symptom of snoring, that the husbands come and say that my wife snores a lot, or the wife comes and says my husband snores a lot. And most of the time the cause is obviously there can be the symptom of sleep apnea, but in sleep apnea there is no other obstruction, but most of the time these cases also have their polyp growths or nasal terminate growth inside the nose, which can cause this symptom of sonic. So these are the basic symptoms which we come from: nasal obstruction, reduced sense of smell and taste, discharge and pressure, and snoring. So as we had seen that what are the chronic conditions which are associated with the growth of polyp, these are chronic rhinosinusitis, chronic allergic rhinitis, asthma, or immune system dysfunction, which leads to untreated chronic colds. Whenever there is a history of chronic cold, we most of 90% of the times we see these polyps coming up in our growths. And there is asthma also. Then also we can say we can have associated adenoids also there, associated tonsillitis also there. These all are overgrowths which tend to occur whenever there is some change happening in the ear and nose and throat area. The starting symptoms can be even from the ear problem, or from the nose problem, or throat problem, and ultimately you see this whole ENT getting involved, and this is the common manifestation that comes to. And ultimately the patient is advised for surgery, whether through the nose or in the ear, because some of the ENT is always involved in this kind of cases. Then we see the investigative procedures which we use to diagnose this condition. These are physical examination by nasal endoscope, X-ray of the paranasal sinus. When we do the X-ray, we see this whole opaque picture coming up due to the sinusitis also, and due to the polypoid growth. CT scan of the nose and paranasal cavity, MRI of the nasal cavity in case of big polyp growths to see extent of the growth. Sometimes the polyp is so big it goes back till the back of the nose, and it also covers the throat area. So to see the extent of big polyps, we need to sometimes go for MRI. So nowadays it's a very common practice that most of the ENT doctors are advising patient for CT scans or MRIs only directly, because X-ray, it's becoming more of an outdated thing now. And mostly patient comes to the clinic with CT scans, say that we have this CT scan and we have this problem inside, and the doctors has advised surgery. So this is a very common investigation which we come across nowadays. Now coming up to the miasmatic analysis. Miasmatic analysis is very important according to the homeopathic point of view. The things which we saw previously were only for diagnosis purposes, but when we come up to the homeopathic point of view, we see that miasmatic analysis is very important because it helps us to select the remedy. Because whenever we go into the miasm, we see the origin of it. And when we hit the origin, then only we get the right constitutional remedy, and which can lead to, the successful curing of these cases. So the growths of, how are the growths of the psoric origin? Any size growths, these growths can be small or big, accompanied by allergic rhinitis and white colored discharges. Mostly they have allergic rhinitis and white colored discharges. Mostly will have running nose and fluent type of coryza, accompanied by excessive sneezing, complaints associated with polyp growth. So mostly those growth which are psoric in origin are accompanied by rhinitis or chronic type of coryza, which have more fluent discharge and white discharge, and there can be excessive sneezing complaints. So these kinds of cases are mostly psoric. They can have watering of eyes also. They can have certain eruptions also along with these kind of psoric growths. They can have other kind of allergies in the body. They can have allergic urticaria or skin eruptions also whenever there is any kind of psoric origin growth. So you need to take the bigger picture to ascertain the miasm of the thing. But in the ENT area, we are going to see these symptoms only. Now, how are the growths of the psychotic origin? They are mostly bigger size growths, which have mostly yellowish and greenish discharges, accompanied by rhinosinusitis or chronic sinusitis. Mostly have stuffed up and blocked sensation in the nose. Might also have adenoids and tonsillitis growth along with polygrowth. So we are going to see many overgrowths coming up, which have psychotic origin growths, and there can be growths elsewhere in the body. There can be warts in the skin. There can be growths in the uterus. There can be growths behind the ear. There can be growths, in the chest. They can be lipoma growths in the below the skin layer. So these kind of things also come up whenever there are psychotic origin, and mostly the discharges, because they are become more chronic in nature, so they turn into yellowish and greenish discharges, and stuffed up and blockage sensation is mostly present there. Then how are the growths of the syphilitic origin? These are mostly bigger size growths, but can be solved. But mostly there is ulceration present in the polypoid growth. Discharges would be purulent and offensive in nature. They would be purulent and offensive in nature. They will be excoriating discharges also, and they have bloody discharges, and they, as I said, they excoriate the internal lining, because there is destruction associated with syphilitic origin growths. So they tend to, cover up the whole area, and they excoriate and they destruct the mucous membranes, and there can be bloody discharges, and mostly ulceration is present. Whenever you examine the thing, the polyp is not, smooth in nature. It is not shiny in nature. Whenever you see a normal polyp, it is mostly smooth and shiny surface. But when you see a growth of syphilitic, it's mostly ulcerated, maybe corroded, and there may be other. And mostly in syphilitic cases, we tend to get history of addictions, of smoking, of alcohol consumption, and other vices trying to come up in syphilis. This is all I'm telling according to whatever cases I have seen, and mostly the complaints are aggravated at night. Now, this symptom of aggravation in night can be, considered as a common symptom also, because the blocked sensation or sensation can come up in these kind of, because the polyp is obstructing the nose. So aggravation in night can be common here. But if the discharges and the bloody discharges, the excretion, the sensations are also aggravated in night, we tend to take up that growth into syphilitic type of growth. So this is the miasmatic analysis, and this is very important, whenever we are selecting a remedy for polypoid growths. Now, what are the conventional treatment methods that mostly the allopaths, recommend, and what people take? These are nasal corticosteroids to reduce swelling and inflammation. Nasal sprays are very common because it instantly gives relief in the inflammation, the swelling, the sneezing sensation, the blocked up sensation. So we see a lot of over-the-counter nasal sprays are available. Then we have oral steroids to shrink large polyps. Oral steroids are also given. Other medications like anti-allergics, which include antihistamines and antibiotics, are commonly used. These medications are mostly treat the associated conditions like sinusitis and allergies, and sometimes reduce the sign. Now, the reduction in size is very, very less, as it is often seen. Otherwise, the surgery would not have been advised. So, mostly these conditions, try to handle the allergies, the sinusitis, the background condition that is causing the polyp growth. But the reduction in size is very minimal, and mostly they lead ultimately to the surgery of the polypoid growth. Surgical treatment includes polypectomy and functional endoscopic sinus surgery, and which open up the sinus pathway. So there are many cases where the patient might also come to you with that we have already done the surgery, and again the polyp growth has come up, the growth in the nose has come up, and again the doctor is advising for the surgery. So this loop, it continues. So we need to break the loop, and that loop can be only broken by homeopathic medicine, by constitutional homeopathic treatment, which leads to recurrence also of the polyp growths. So as I said, the recurrence polyps often return, requiring ongoing maintenance with nasal sprays or other treatments. Side effects of these medication include long-term use can cause increased intraocular pressure, cataracts, thinning of the skin, making consistent low-dose management very essential. So it is very, very important to see that whatever side effects, and especially in children, they are exposed to many antibiotics, antihistamines, which compromise their immunity, and lead them as a prey to other opportunistic infection also. So this is very important that we make informed choice, where because the patient comes up with a lot of hope to a homeopath that we need to avoid the surgery. So the homeopath also needs to do his or her homework well, need to study the case well, see the miasmatic analysis, and accordingly select the dosage of the drug. So next, coming up to the homeopathic therapeutics, what are the major medicines which work in this area are? So I have personally also seen a very good result with the Calcarea group of remedies in cases of polyps. Obviously, the first one here mentioned is belladonna, but first we can look up at the Calcarea group of remedies. So we have Calcarea carp, where the polyps are of psychotic origin, chilly patient and tendency to catch cold easily, fearful, indicated in children with adenoid growths. Obviously, Calcarea group would have growth issues there. They would have their fearful tendency. In this whole of the Calcarea group, we see more of oversensitive children, most of the chilly children or chilly patients, oversensitive patients, and fearful patients, and they have a lot of insecurities. Calcarea group has a lot of insecurities coming up. So and majorly in Calcarea carp, we see fearfulness, chilly patients, and tendency to catch cold easily. And where, as I told you earlier, also in psychotic type of the growths of polyps, we see other type of psychotic growths coming up, whether in the form of adenoids or tonsillitis or any other overgrowth present in any other part of the body. Then we come to Calcarea fos. It is indicated in children with stunted growths and height issues. Mostly these have, delayed milestones. Calcarea fos children have delayed milestones. They might also have certain, mind issues where they're there is learning problem or learning disability is also present there in these Calcarea fos patients. And height is also less and growth is less, and they might encounter, these polyps, and these patients are also chilly in nature. Next, two very important medicine which we can use in polyps is Calcarea iode and Calcarea fo, used in polyps which are of long duration and are hardened. So wherever you see the cases where you see even nasal turbinate hypertrophy, where, as I said previously, they are Pore of cartilageous growth. There also you can use calcarea iode and calcarea fluor with very good results in 6s potency and in lower potency like 6C and 3C. And they also remove the tendency to reoccur. Calcarea iode can be used in hardened growths or where tumors are present in the uterus. Along with this, they have tumors in the nose, and we have hardened, lipomas beneath the skin. There, calcarea iode also works very well in these kinds of polyp growths. Next, so this was the calcarea group where we use these 4 calcarea medicines majorly. Then we also obviously have our belladonna with bright red colored fleshy polyps where there is a lot of congestion. There's no lot of sneezing coming up, lot of redness of the mucous membrane coming up, redness of the eyes coming up, and so those cases where we have redness and uh, uh, attacks of rhinitis coming up suddenly and with flushing of the face, we tend to give more of belladonna, where we see dissolving polyps mostly in higher potency like 1M potency. Next drug coming up is conium. Conium is given in psychotic and syphilitic origin of polyps with enlargement of other glands like tonsils, adenoids, and history of cancer is present majorly in conium patients. Cancer history is very important in in cases where we tend to see that the case is coming up to syphilitic type of growth. Complaints of obstruction are aggravated at night. So whenever you see a history of cancer coming up, other medicine which we use, you can say we can use carcinosin, but carcinosin is more indicated. Obviously, there is history of cancer, but we tend to see other things also. Like there might be a history of abuse of the patient, or there might be history of suppression of the emotions. So conium is majorly indicated in hardened growths and other glandular enlargement also, and history of cancer is also present there. Then we come up with heparin sulf. Heparin sulf has allergic hay fever. Again, allergic rhinitis coming up here. Psoric origin polyps, complaints of sneezing and in change of season, and from drafts of cold air is present. Here, the discharges are mostly fluent, but they might also be yellowish in color in heparin sulf cases when the case has become more of chronic. But the origin here is mostly psoric, and their complaints are aggravated mostly in change of season and from drafts of cold air. Then we have Kali bicromium coming up here, where we have psychotic polyps, complaint of chronic sinusitis with polyp complaints, yellowish and greenish discharges, post-nasal discharge with obstructed feeling in the nose. Along with Kali bicrom, one medicine I have not mentioned here is hydrastis. Hydrastis have also yellowish discharges which have thin ropey or sticky discharges coming up, and they can be also given in cases of nasal polyps, and they control the discharges and cases of sinusitis very well. So whenever that background is of sinusitis and we see kind of ropey, thinny and stringy discharges, and we give hydrastis, that takes care of the back condition. You can give other medicine to control the growth, to reduce the growth of that polyp, and along with that you can give hydrastis and caliboichromicum to treat the sinusitis that is present behind. Then we have a very wonderful remedy in the form of lemna minor, very useful mother tincture in reducing polyps, obstructing sensation, along with family history of any kind of fleshy growths. So I have personally used lemna minor, and we're going to see a case where we'll reduce the polyps with the help of lemna minor. Then we have mercurius, which is coming up in syphilitic type of polyps, stuck up cases with chronic discharge which are associated with ulceration. Mercurius come up in that cases, and we have chronic yellowish discharge coming up here also, and aggravation is present, discharges at night. Then we have merc iode, hard polyps with syphilitic history, nitric acid, fast growing polyps with profuse discharges. Okay, nitric acid have fast growing polyps with profuse discharges and history of cancer. So whenever there is fast growing polyps, when we see that the size of the polyps is growing very fast and there is ulceration and discharges are excruating, then we tend to give towards nitric acid. Nitric acid is a rare medicine which we tend to think of in polyps. But if we, in these cases also, if we have, ulceration history and fast growing, or even you have any history of cancer, then also you can think of acids coming up in the use of polyps. Then we have other medicines like pulsatilla, sanguinaria, sepia. Silicea is a very good medicine in cases of polyp when we have chronic tendency to catch cold, chronic oversensitiveness, patient is, collecting things or is obstinate and headstrong, then we tend to give silicea. Silicea is also a very wonderful drug in cases of polyps. Teucrium is also a very wonderful drug. Thuja obviously is an antipsychotic, anti-miasmatic drug which we can think of. Pulsatilla is given in cases of chronic coryzas when there is thirstlessness and the mental picture matches with that of pulsatilla. We think of pulsatilla. And one important thing that I have mentioned here, sulfur, tuberculinum, and thuja is to be used as intercurrents in high potency. This is my personal experience that if you give tuberculinum whenever there are lean patients with chest complaints coming up or with growth issues coming up, we tend to give tuberculinum. This I have used in many kids as tuberculinum is intercurrent, and then we see our drug, the constitutional drug, becomes it acts more vigorously and more aggressively whenever we give this intercurrents. Sulfur can be used whenever there is a history of allergies, history of urticaria, or whenever you get a mental picture that is coming up. Then thuja in psychotic growths, we can use as a intercurrent. So these were the basic medicines which we use in therapeutics. You can use other medicines also. We see a lot of natramure cases. We see a lot of ignitia cases also whenever there is an emotional or mental picture matching up. So you can see use any other medicine which is matching with the drug picture. But these are the specific therapeutics which I have shared here. Now coming up to the cases. Now, I was not able to, complete the cases. I didn't have the time to, write down the cases. So I'm going to share here two cases majorly. One, we will see how constitutional treatment has treated the nasal growth of polyps. And in the other case, we are going to see the action of the specific remedies that cleared up the case of polyps. So the first case was of a 42-year-old female who was residing in Gurgaon. And she was a doctor herself. She was a gynecologist doctor. And she came to me with the reference of one of my patients who used to visit my clinic. She said, my sister is living in Goa. She's a doctor herself. And she wants to, consult you for this growth of polyp. So because she had done her CT scan because she was a doctor, and she approached her fellow friends for the CT scan. And in the CT scan, there was a large polyp growth in the left side of the nose. And there was a history of chronic sinusitis coming up in the case taking. There was, since her college time, she was suffering from this problem of chronic sinusitis. This developed into this bilateral polyps. I'm sorry to say, it was not a single polyp, it was a bilateral polyp which was there in the nose. So she used to suffer since long time, and she used to take homeopathic medicines already for this condition. And she also told me that she had taken up Kali bichromicum previously. She had taken even lemna minor also, and that relieved her sinusitis symptoms. But since past 2 years, this obstruction sensation was growing up. So she went in for the CT scan, and these bilateral polyp growths came up. So in spite of her medicines taking, obviously the course of the treatment was delayed, but the polyps eventually developed in this case because the inflammation was coming now and then. Obviously it was handled by homeopathy, but that was only a specific medicine that was reducing the symptoms, but not dissolving or stopping the condition from letting it go into the polyps. So she said that I don't want to go in for the surgery, so can you advise me something so that these polyps are dissolved by itself? So as a she was a gynecologist, so I was not able to obtain certain mental symptoms from her directly, but because her sister, who was my personal patient, I asked her how kind of what kind of mental makeup she had, how did she react to stressful situation, and what is the life history, if you can tell me something about it. So her sister told me that she was a very, very passionate student, and she wanted to, become a doctor very passionately, but due to her family circumstances, firstly, they were not as financially strong to, support her medical education, and secondly, her father also expired very early. Then later on, her brother also expired, who was very young. He expired in an accident, and that caused a major emotional blow on her. And due to that, their financial condition was, or also, it started deteriorating more. But still, she had the passion to become a doctor. So, by overcoming all odds, even by working, odd jobs, she collected money for herself for her education, and even after suffering the emotional blow of the death of her brother in the accident, she never gave up on her dreams, and she wanted more vigorously to become a doctor. So she was a very passionate human being who want to pursue her dreams. But eventually, fate had other plans. She was married off by her relatives and her mother, that you need to marry off because you are also growing up and we don't have any other support. But you need to marry. I need to marry you off, that you also stable in your house. So she was married off, and in her after her marriage, also in that her in-laws' home, she was not supported for education, because her husband was not a medico. Yeah, her husband was not a medico, so it's very difficult sometimes for a doctor. They need to, have a certain life partner which support their education, their profession. So she was not supported by her husband, her in-laws, and she had this long reel. She had to fulfill her other responsibility and still become a medical leader. So, in spite of these struggles, she had this passion, and right now she was quite a successful doctor in her field. And another problem was that her child was also a special need child. He had epileptic attacks often now and then, so he also needed special care. In spite of that, her passion was very strong. So now this passionate thing, whatever is, led to studying up of the materia medica, and mostly females who are very passionate about the career are mostly ignitia females. So other, physical journals were quite normal. She had normal diet, normal thirst. Mostly her sleep patterns were disturbed because she used to, work long hours. So she used to had a lot of fatigue and a lot of tiredness. So she kind of was overworked. Now this symptoms of overworking and, which we Ignitia has a symptom of, cloudiness and sometimes confusion and tiredness coming up from overwork. So these symptoms were also taken up in our drug selection of overwork causing aggravating her complaints and causing fatigue and, cloudiness of the brain. And there was this passionate thing coming up. Then she also had headaches off and on these temple areas, which was another indication for ignitia. So we see very different drug coming up here. As I told you, there can be other drugs, those drugs which I have mentioned. So ignitia was coming up in her picture. So the mental picture was very much pointing towards her physical complaints were, very general, that discharges were there due to the sinusitis, there was obstruction, and other physical journals were not all, very specific. So the main thing which we needed to see in the case were the mental. So after taking up the case, we tend to see that these mental symptoms of being passionate, being aggravation from overwork, temples, pain coming up, and, being very emotionally sensitive, very touchy individual. Because whenever, she used to sometimes not take up the pressure, she used to, express her anger also. So Ignitia are also very expressive females. So here in this repertorization, we selected Ignitia as the drug, and we started with Ignitia 200 as the medicine, where OD dose was given for 15 days. Single dose every day, water doses of 5 drops was given in this case, and which, decreased her headache and fatigue symptoms to a lot of extent. So Ignitia 200 was started for 15 days. After that, it was repeated for 15 days again, OD dose. For 1 month, Ignitia 200 went up, which improved her mental fatigue, her physical fatigue, her symptoms of pain in the temples. Obviously, the growths were not reduced because it takes time to reduce the growth. After Ignitia 200, we put her on Saclac. Her sinusitis symptoms also reduced after Ignitia 200. In the second month, when we introduced Saclac, in that month, her sinusitis symptoms also reduced. And for again, in the second month, we went on for Saclac only. Thereby, her sinusitis symptoms, they were coming up in longer intervals now. So obviously, the sinus, and she said she was now not depending upon Kali bichromicum and lemna minor anymore to treat her whenever cytositis complaints were coming up. Those attacks had reduced to much extent. Uh, we in that after these things we switched on to Ignitia 1M. In the third month, Ignitia 1M was given for 1 week, followed by Saclac for further 3 weeks. And after that, we gave her Thuja Varam as intercurrent because there was a lot of, emotional factors coming up. So, and she was bursting into anger outbursts very sometimes, not often. Most of the time, she used to keep her emotions inside. So, we thought of selecting as a psychotic drug as Thuja 1M, and then we proceeded towards, actually, the slides are not more there. I have not written the cases. That's why I'm just presenting the oral case. Okay. So after Ignitia 1M in the third month, we gave her Thuja 1M, and we continued with the Ignitia 1M in the fourth month also. And after 4 months of this medicine, initial Ignitia 200, then Saclac for 1 month, then Ignitia 1M 1 again for in the third month, followed by Thuja 1M intercurrent dose, and then Ignitia 1M again in the fourth month. We advised her to go in for the CT scan again. And for this, when she went in for the follow-up scan, her polyps were reduced almost half in size. So here we see the power of constitutional drug approach. How Ignitia reduced her bilateral polyp growths. Later on also she continued Ignitia 1M for 2 more months, but she didn't went in for the CT scan again. But obviously, from the initial treatment, we saw that the bilateral polyps, they reduced almost half in size. So this was a case where we see the constitutional power of homeopathy, working in cases of polyps. I'm going to share one another case. Actually, I didn't have the time to write down the case. That's why I'm sharing them orally. Otherwise, I always write down the case. There was a certain issue of time here. So in the second case, we see this person was a male patient, which majorly came in with the complaint, of snoring and obstruction of nose at night. So he came up with this major complaint of snoring complaint, and the main person who came up with this complaint was his wife, that he used to snore a lot at night, and he had a lot of issues with the obstruction in the nose. So he majorly came up with the complaints of snoring coming up, and he asked for my problem, for my treatment for this problem. So I advised initially him to go in for the X-ray of the paranasal sinus. X-ray revealed, haziness of the sinus and slight growth on the right side of the nasal cavity, and that was also, only covering half of the nose, not the full growth, but still he had a major complaint of obstruction and snoring coming up. So X-ray was advised, no CT scan was advised, and he had major issues, of itching and tingling sensation coming up mostly at night. and he used to get a lot of irritation. Also, in the change of season, he used to have this itching and tingling sensation inside the nose. So the major complaint was of snoring and this tingling sensation that used to come up, and there was scratching sensation on the tip of the nose also. And he had, allergy attacks whenever there was, change of season. Also, he had the family history of, growths in the nose and growth in the he had his mother going for the operation of uterus removal due to fibroid growths in the uterus. So there was a psychotic history coming up here in this case of growths. And his father had a history of chronic bronchitis. He was a smoker, so he had a history of chronic bronchitis coming up. So here we see more of psychotic history coming up. You can think of, Tuja here, but I was inclined towards, antipsychotics, other antipsychotics here. Eventually, we will see when we see the mentals of the patient. So he was physically, the main complaints were of snoring, obstruction, and tingling sensation in the nose. And physical journals were quite normal. There were desire of sweets present in there in this patient. He was very much inclined to take sweets. And when we came to the mental journals, mentally, he was a very, very intelligent patient. He used to work in the marketing sector, and he used to have this great knack of, convincing the clients to, to buy the product. So he was quite an intelligent person, and he was a person with good height, slender height, and uh, quite intelligent. And he used to, enjoyed things like painting and listening to music. So his higher intellectual faculties were quite developed. So these symptoms were pointing towards a more of a refined remedy like tuberculinum. So here, two main remedies which were coming to my mind. That is, choosing the physical symptoms. That was teucrium, because it was a not a very big growth, and there were symptoms of tingling and itching sensation present. There was aggravation in change of season, and so these leads to, I started the case with doses of teucrium, BD dose for 15 days, and no other medicine was given after that. Teucrium was given initially, and teucrium was continued for 3 months. And that, relieved his sinusitis problem, his obstruction problem, his itching in the nose and tingling sensation. But the growth did not reduce after teucrium. Uh, Otherwise, we see that teucrium is a very good medicine indicated in overgrowths and, growths inside the nose. But teucrium only reduced, his physical symptoms, and the growth was not reduced. And these mental symptoms, I later came up, started taking up the case again, because initially he only gave his physical symptoms of, chronic discharge, chronic obstruction, and a snoring problem. And later on, when we took up the whole case, we found his more of mental symptom, what a refined personality he was. And on that basis, we gave him tuberculinum 1M, 3 doses. And then we followed up with Saclac. That is, after 3 months of teucrium, we selected tuberculinum 1M, and we followed up with the Saclac. After that, his complaints were not, they did not come back. That means his sinusitis was quite, better from the doses of teucrium. And we repeated the tuberculinum dose in the second month also, 3 doses followed by Saclac. And after that, we advised him again to go in for the X-ray of the paranasal sinus. So the X-rays were almost show 75% reduction in the growth of the polyps. So here we see more of, action coming up from, the specific medicine and the intercurrent medicine of tuberculinum. Constitutional drug was not, as such coming up initially in the case, but later on, when we see the mental symptoms of the patient, when we see the whole picture of the patient, we tend to select the tuberculinum. And other reason for selecting tuberculinum, was his physical constitution, and also the history of, because his mother had a psychotic history, his father had a bronchitis history, and history of smoking. So these tends to narrow up the chest cavity also, and they tend to pass on the genes of tubercular constitution in the patient also. So this whole drug picture led to the selection of tuberculinum remedy in this case, and this case was treated by tuberculinum and teucrium. Teucrium healed up the sinusitis, and tuberculinum reduced the growth of the size. So we see a contrast in these two cases where ignitia was the major remedy which completed up the case in spite of the other specific medicine being used. But in this case, teucrium being a specific remedy for sinusitis and tuberculinum as a antimiasmatic drug completed up the case and reduced the size of polyps. So we can have both kind of approaches here. As I told you, lamina minor, I have seen a reduction in growth from lamina minor also, but obviously in some cases there are certain stuck up cases where we tend to use the more of constitutional remedies, and I have very good seen good results with calcarea iode. I've seen good results with silicea, mostly in smaller children, and tuberculinum also have given very good results in smaller children, mostly oversensitive children, intelligent children, and mostly having higher intellectual capabilities. So this was all today from my side on polyps.
Okay, madam. It was really a simple and nice presentation on chronic rhinitis with nasal polyps.
Yes.
Yes, actually, you told the differences between nasal polyp and hypertrophy nasal turbinates in a
Yes.
simple manner, and you dealt with all the homeopathic management, all the
Yes.
drugs, important drugs, and all. And you said about the two different approaches in this condition regarding the constitutional and specific medicine. And everything was really wonderful and nice. And if any doctors have any doubts or any queries, you can ask now. Or any doctors, if they want to share their experience in dealing with chronic rhinitis or nasal polyps, let them share. If anybody have any doubts, please raise your question.
Yes,
No doubt.
Dr. Neha Kakkar, it was really a very good session. This is a common problem with people living in villages, particularly those who are using the bath in homes. This is one of the troublesome problem for them, because I still remember a case which was operated thrice. This is a typical rhinoceros with the polyp coming out of the nostril, and it was hanging down below the lid,
Okay.
and it was operated thrice, but still it is continuing. But as and when the patient came to me, and after having a treatment for about some 6 or 8 months, the patient uses a little time feeling better. But one day the patient is having severe bleeding from the nostril, and they really afraid what is going to happen. But then the person, the bystander came to me, and I was not in the home or in the clinic. Then they came to the city where I was, and then I collected the medicine phosphorus 30, and I just give him on that basis of that. And the very next day they called me and told me that, doctor, it is no more there. But I have no such belief in that days, because I was just a beginner in those times, some 25 years back. No, some 35 years back, 30 to 35 years back, the things happened. And what happened was that I told them that please come to the clinic on the very next morning. But they didn't came, but only they came on the weekend. That's on Saturday night by about 7:30 p.m. They came, and then I asked them why you didn't came on to me. I thought that it was not gone. That's maybe the reason the patient not respond to my call. But when I searched the nostril, like what I found that there is not even a scar in the nostril. That
Okay.
that was that much of relief. That much of that's what we can call a cure. And
Yes.
thereafter, the patient lived for about 20, 25 years.
Yes.
And she never had such problem. That is the beauty of homeopathy. That's how homeopathic medicine works in certain conditions. But the thing is that the doctor should have the firm belief in your medicine.
Yes.
We have the tools with us. Unfortunately, people still don't have so much of confidence in themselves. That's the reason why most of the patients are not able to get
Yes.
completely
We-
cured. Anyway,
Yes.
the case presented by you are really excellent, and we need to look into all aspects. But uh, what you have to look at, the most important thing is that what you see in front of you at the time of consultation, that is more important than whatever be the reason. Then,
Yes.
unfortunately, people used to think of what was there some years back and what like that. But you can understand the expression of the patient itself says whether she's having any mental trauma in the past or at present. So that means of thing I would like to add to this session. Congratulations for coming
Thank you.
over here.
Thank you,
Hope
Dr.
that you
Ganesh.
can come
Yes.
over here with some more presentation also. I think
Thank
Dr.
you.
Ambrose sir want to speak something.
Madam, there is a question in the chat box
Yes.
regarding the use of patent medicines in chronic rhinitis and
Yeah,
nasal
Dr.
polyp.
Akanksha,
Can you
obviously patents are flooding the markets, and it's very easy to fall in this trap to give the patents and but these are only palliatives which you can just give to palliate the patient and to just pacify. It's like a pacifier to the patient. No patent is can replace the constitutional medicine, the totality medicine, and that is the drug which is going to reduce the size of the polyp. It is not the patent that is going to reduce the size. They can just palliate the symptoms, and that too uh, for a limited time period only. After a certain period of time, patent will stop working because it is just acting like an allopathic antihistamine or a painkiller which only pacifies according to the symptom. As soon as the immune system stop reacting to the patent, that I have seen myself in my practice, because we tend to see everything with our own eyes, as Dr. Henneman says. Until you experience yourself, you are not going to see. And constitutional drugs works magicfully, very wonderfully, if the selection of the similimum is right. That is the main medicine that is going to bring you the cure. So I guess that is self-explanatory.
Okay, ma'am. Thank you. Thank you for the wonderful section.
Yes.
Thank you.
If anybody
Thank you, Dr. Neha.
some more queries?
Hello.
Yeah, Hanji sir.
Thank you. Thank
Okay,
you,
sir. It's audible.
Dr. Neha Kakkar ji. Very nice, excellent session. Nasal polyp and chronic rhinitis. Lot of medicine described. According to miasmatic is the best treatment, and diathesis, tuberculosis diathesis. Bacillinum or tuberculum intercurrent remedy, and thuja is the very important remedy.
Yes.
Without thuja, not cure the polypus.
Yes.
And lemna myra signoria, right-sided remedy, very good.
Yes.
Right-sided remedy. Calcarea car theory of constitution, according to constitutional and miasmatical. Miasmatic important. Suric and psychotic miasm. Okay. Thank you.
Thank
Thank
you.
you, Dr. Neha Kakkar. Very good.
Thank
And new moderator, Hema Sekhar.
Okay, sir.
Very, very thanks.
And this is my
Thank you.
second section. Okay, sir.
I am in first session. Hema Sekhar. Thank you, everyone.
Okay, sir.
Namaskar.
Thank you.
Okay, sir. Let's conclude.
Yes.
Okay.
Yes.
Okay. I would like to thank Dr. Neha Kakkar for handling a beautiful section on chronic rhinitis
Thank you,
on
Dr.
behalf of IFPH.
Yes, thank you so
And
much.
okay, I thank one and all who have attended this section, and let us work together for the betterment of homeopathy and to propagate our system. And let me thank one and all. And English section is over. Now let's move to the Malayalam section.
Thank you everyone, and Dr.
Thank
Tanir.
you, thank you. Ghar homeopathic, ghar homeopathic.
Okay, sir. Okay. Thank you, one and all. Now let's move to Dr. Shaila. She will handle the section.
Okay, thank you, Dr.